Welcome back, everyone. For this video, we are going to go over self-massage techniques for specific muscles from head to toe. You will see pictures and videos. Feel free to follow along. The temporalis is the muscle that covers the temple above and in front of the ear. It is large and flat and helps with chewing. Trigger points here are very common and can cause headaches. The pink tab is the trigger point and the white outline is the area where you might feel pain. To work this trigger point, massage with supported fingers. Hold your knuckles with your opposite hand and tilt your head to apply pressure. Max is going to show us how to perform trigger point massage to the temporalis, where he's pointing. First, he's going to set up his fingers. Now he's going to bring in his other hand to support the knuckles. Watch how he tilts his head, using gravity to help apply pressure. Now he performs a few strokes slowly up and down. The trapezius is the thick muscle between the side of the neck and the top of the shoulder. It helps move the shoulder. Trigger points in the trapezius can cause temple headaches and neck pain. Nearly everybody has trigger points here. The black X is the trigger point, and the white outlines are the areas where you might feel pain. To work this trigger point, massage the trapezius by rolling it between your thumb and your first two fingers, using the opposite hand. Tilt your head to the same side while you are massaging to relax the muscle. Rest your elbow on a table as you reach across your body. If this technique is too hard on your hands, you can use a ball against the wall instead of your first two fingers. Here, Max is pointing to the trapezius. He is going to massage his trapezius using his thumb and first two fingers. He performs the massage using slow pinches, or you can roll the muscle back and forth. If using the ball on the wall technique, remember to still apply pressure from the front using your thumb. The trapezius is very dense and requires pressure from both sides for good trigger point massage. The rhomboid muscle is attached to the spine and the shoulder blade. It helps move the arm up and down. Many people hold tension here because of stress, which can cause this trigger point. The black X is the trigger point, and the white outline is where you might feel pain. To work this trigger point, use a ball against the wall and roll up and down. Here, Max is going to point to his rhomboid. Using the ball against the wall technique, he puts the ball in the right spot before turning to the wall to get set up for massage. If this is too difficult, you can use the ball in the sock and then perform slow rolling up and down. The Serratus posterior inferior muscle attaches to the four lowest ribs and the lower spine. It supports the body while moving and breathing out. Trigger points here can make it painful to bend or twist. Stretching too often overhead to reach things up high can also hurt this muscle, so arrange your environment to limit this movement. The black X is the trigger point, and the white outline is the area where you might feel pain. This muscle can be hard to reach, so put a ball in a long sock, pantyhose, or pillowcase and place it against the wall and roll up and down. Here, Max is pointing to his serratus posterior inferior. He is using the ball in the sock technique to get the ball in the right place before moving to the wall. Now he can perform slow rolling up and down. The gluteus minimus is a muscle of the buttocks that supports the pelvis during walking. Sitting on a flat wallet or sitting or standing for a long time without moving are well-known causes of trigger points in the gluteus minimus because of decreased blood flow to the muscle. Trigger points here can cause a deep, achy pain in the buttock and along the side of the entire leg. Walking, standing up, and even crossing your legs may be difficult and painful. Limping on the painful side is common too. The pink tab is the trigger point, and the white outlines are the areas where you might feel pain. To work this trigger point, use a ball against the wall and roll side to side or up and down. Let your other leg hold most of your body weight so that the painful knee can bend slightly, which allows the muscles in that leg to relax. Here, Max points to his gluteus minimus. He gets the ball in the right spot before turning to the wall. Now he can perform massage using slow movements rolling up and down. The deltoid is the muscle that completely covers the shoulder. It has 3 sections, on the back, the side, and the front of the shoulder. It helps to raise the arm in any direction. Trigger points in the deltoids are usually caused by repeated use when the deltoids have to work harder to keep the arm in its socket. Doctors often blame pain here on arthritis. If you have trigger points here, you probably feel the most pain when you are moving your arm, and less pain when your arm is at rest. If you feel constant pain in your shoulder, even when your arm is at rest, this means that the trigger point is probably somewhere else. The green tabs are the trigger points, and the white outlines are the areas where you might feel pain. To work these trigger points, use a ball against the wall. Do not use your hands for treatment here. You can work one trigger point at a time by rolling up and down with the ball, or you can turn your body at an angle so you can roll the ball side to side over all 3 trigger points. Max is going to massage his deltoid. He gets the ball in the right spot before turning to the wall. First, he is going to massage one deltoid by rolling up and down. Then, he is going to roll side to side to hit all 3 trigger points at once. The triceps are a set of 3 muscles that straighten the elbow and are connected together near the shoulder. Trigger points here can weaken the elbow and can make it painful to bend and straighten the elbow. Doctors often blame this pain on arthritis and tendinitis. The green tabs are the trigger points, and the white outlines are the areas where you might feel pain. Pain in the inside elbow, the first picture, is often called tennis elbow, and pain on the outside elbow, the third picture, is often called golfer's elbow. You might feel pain right on the tip of the elbow, the second picture, when resting it on a table. To work these trigger points, you can use a ball on the table, massaging with your knuckles and moving your arm back and forth. You can also work the outside trigger point using a ball against the wall and rolling up and down with your hand behind your back and elbow bent. Max is now going to work trigger points in his triceps. First, he gets the ball in the right spot. Then he turns to the wall, where he can slowly roll up and down to massage his triceps. You can also use a ball against the table, using your knuckles to perform massage. You can either rub your tricep back and forth along your knuckles, or you can rotate your hand so that the knuckles are doing the movement. Although you cannot see his other hand, make sure that the hand of the arm you are massaging is relaxed. You want to keep all the muscles in your forearm and upper arm relaxed during this process. Pronator teres is a forearm muscle near the elbow, and pronator quadratus is the forearm muscle near the wrist. Both muscles work together to turn the forearm so that the palm faces down, a movement called pronation. Trigger points here can cause pain along the inside of the forearm and pinky side of the hand, and can cause numbness in the middle and ring fingers. Doctors often blame this pain and numbness on carpal tunnel syndrome. The green tabs are the trigger points, and the white outlines are the areas where you might feel pain. To massage these trigger points, bring both arms behind your back and massage the painful arm with the opposite thumb. You can also use a ball against the table, rolling back and forth. Be gentle when massaging the pronator quadratus because the wrist has many small nerves and blood vessels. Now Max is going to massage his pronator teres and pronator quadratus. He brings both arms behind his back, relaxes his right arm that's being massaged, and works his pronator teres with his opposite thumb, before moving down to pronator quadratus to do the same at the wrist. You can also use a ball against the table to massage these points. Make sure that your opposite arm is the one that's doing the moving, and keep your wrist of the arm that's being massaged relaxed to keep all of the muscles loose. The adductor pollicis is a small muscle in the hand that makes up the web between your thumb and your palm. It moves the thumb toward the hand from side to side or from the front. The green tab is the trigger point, and the white outlines are the areas where you might feel pain. Work this trigger point by gently pinching the web of your hand between your opposite thumb and fingers. You can also use a ball against a table or behind your back against the wall. Now, Max is going to work trigger points in his adductor pollicis. He is going to use his thumb on the palm side of his hand and a few fingers on the opposite side to work the web between the thumb and the first finger of the painful hand. That's all we have for this week's sessions. Please tune in to our future videos to learn about other strategies you can add to your pain management toolbox. Thank you so much for watching. See you next time.